Hi, my name is Katrina Dunn, and today I'll be discussing Ativan, or the generic name lorazepam. It's a benzodiazepam that depresses the CNS and usually works on the GABA inhibitory neurotransmitter. It's usually used for anxiety disorder, but also often preoperatively to decrease the anxiety surrounding sedation. The medication is taken either by mouth, sublingual, intramuscularly, or intravenously. Contraindications would be pre-existing CNS depression, severe uncontrolled pain, severe hypotension, and sleep apnea. Your lab values generally aren't going to be used for normal dosages of it, but if you're using high doses, you're going to be monitoring for renal, hepatic, and hematological function. For any time you're doing prolonged therapy, you want to make sure that your patient isn't becoming physiologically or psychologically dependent on the drug, so you want to restrict the amount available to the patient and their access, assess the needs for treatment. You also want to caution for children under 12 years old with this medication and make sure you're using lower dosages in the elderly. Side effects generally are dizziness, drowsiness, lethargy, and some respiratory depression. But it can cause apnea, cardiac arrest, and constipation, nausea, vomiting, and diarrhea. There are no known incompatibilities so far, but the antidote is flumazenil. So if your patient starts having a lot of respiratory depression, that's what you would administer. I will now demonstrate how to take the medication on myself because I'm at home alone. So you would take the medication. You would make sure that the patient has, that you've went over 2 identifiers with the patient, and then you'd have them place it in their mouth. And take a lot of water to make sure it comes down. After administering the medication, you'd want to do some patient education. So you want to make sure the patient knows to take it as directed and not to skip or double up on missed doses. You also want to make sure if they're going to stop taking the medication that they need to decrease the medication slowly so they have less withdrawal symptoms. You also, whenever the patients are first starting the treatment, they need to avoid driving or using any type of heavy equipment because this can cause drowsiness and you don't want them to be behind the wheel for that. They also need to avoid alcohol or any other CNS depressants because otherwise the CNS depressants will start stacking on each other and cause more respiratory depression. The biggest thing you should teach patients whenever you're discussing Ativan and their use of it is other anxiety reducing methods. That way they don't have to use as much of this medication and can calm themselves down maybe a little bit more on their own. Thank you very much. Have a great day.